be towards the end of a beautiful, beautiful meal. So just really give it a try. It is a spectacular dessert, really quick and easy. However, we are going to start off with the topic of the day.
Yeah, the first we're going to discuss about something that, it happens more common than people think. This is the first one. It's going to be about travelers, thrombosis, or travel-related blood clot. When you travel, you're sitting there quite often, constricted. You're not really moving around. And this is very, very dangerous. It really affects many people. People that have high blood pressure, diabetes. It's just something that, as they say, it's like it's a hidden complication. Many physicians always say that. They say this is very, very dangerous, and more understanding, a better understanding of your body, what can happen, can really make a whole lot of difference. We're going to be joined in later by our esteemed guest, Dr. Mohammed Al Sheef, who is a consultant internal medicine, thromboembolism, and vascular medicine. This is something that we're going to be discussing about travelers, thrombosis, or travel-related blood clot. So right now, dear viewers, we'll go ahead and take a quick break and be joining back with our esteemed guest. Stay tuned.
Right now, we are here at King Fahd Medical City, of course, with us here, Dr. Ohoud Alarfaj, clinical pharmacist. First of all, we thank you so much for having us here in the hospital at work time. My first question will be, tell us about what are the role in clinical pharmacist. Give us information about that.
Okay. As a clinical pharmacist, we start to cover in the thrombosis clinic from last year, and we need to be there for monitoring for drug-drug interaction, drug-food interaction, and also the medication that the patient come to the clinic and he's taking it, because the warfarin has many drug interaction. For the patient who has venous thromboembolism, there is two anticoagulant medication. The old anticoagulant is either subcutaneous or oral. Subcutaneous is low molecular weight heparin, which is enoxaparin, and the treatment dose is dependent on the patient weight. Also, we can use it as prevention in smaller dose. Other medication is warfarin, which is come in many strengths, such as 1 milligram, 2 milligram, 2.5, and 5 milligram. And it's need continuous monitoring for the INR for the patient, and continuous change according to the INR. Also, we give the patient this booklet for warfarin to check their INR and also adjust the dose accordingly. Regarding the new anticoagulant, we have new rivaroxaban and also dabigatran, and also anti-platelet medications such as Plavix and aspirin, which use in some patients.
Tell us, doctor, about the medication we must use. Can you give us information about that?
Regarding the medication, there is a lot of medication that can be misused by the patient. So that's the role of us as clinical pharmacists to counsel the patient for the good way to take their medication.
Doctor, a media you like to send to the or message you like to send to the media, to the community. What kind of message regarding, of course, today's subject?
Okay, regarding the anticoagulant medication, we have to tell the patient that they have to take it regularly, don't miss the dose, and take it as the physician instruct them, and follow the clinic appointment, also to monitor their health also.
With that, we're back from the wonders of the kitchen and that delectable dessert. Let us move on and talk about something that really affects a lot of people, and we do not really have the right kind of awareness about it. We are going to be discussing the traveler's thrombosis, or the travel-related blood clot, with Dr. Mohammed Al Sheef. He is a consultant internal medicine and vascular medicine specialist. So, assalamu alaikum and welcome to the show. Now, Dr. Mohammed, for all of our viewers who are watching you right now, what is the travel thrombosis?
Yes, traveler thrombosis or traveler-related blood clot. It is a kind of venous blood clot that affect the lower extremities, legs, in the deep vein system, and it does, break off or separate and move through circulation and travel to the lung. We call it venous thromboembolism, or VTE. In the leg, we call it DVT, and in the lung, PE. So collectively called venous thromboembolism. This is a kind of venous thromboembolism that follows long-haul flight, ideally more than 8 hours, and not necessarily to be air travel. It can follow, travel by other modes of transportation. Initially was introduced to the public as economy class syndrome about 1977. This is the economy class syndrome. You will hear it in the media. It's actually our topic is very hot topic for the media, and you will hear from time to time about stories about traveler thrombosis. So initially described 1977, and since then we have hundreds of case reports. I think this is very important topic. It is a preventable cause of thrombosis or blood clot. That's why we need to educate the public about how to recognize this, disease, and to prevent it from occurring and prevent its complication.
Now, doctor, a quick additional question. This particular disorder or disease, if we may talk about, does it only affect a certain age group, or could anybody in any gender, any age group be affected by it?
Excellent question, very important. That's why, just to reassure the public before we go to that, the risk, the incidence, or how common is low. This is, bottom line, is low to occur in the general population. That's why medicine is not black and white. So we have to, categorize or risk stratify population to low risk, to intermediate risk, and high risk. So usually for the low risk people, i.e. young people, less than 60, they don't have any hereditary blood clot disorder. They don't have, they are not pregnant or postpartum. They are not taking oral contraceptive pills or hormone replacement therapy. They are not undergoing recent surgery, or they have plaster cast immobilization. They don't have cancer. Usually this is categorized as low risk group. So in the low risk group, like the normal population, the risk, it will be like 2 out of 100,000.
2 out of 100,000.
Yes. So just to know that the lifetime risk for any venous thromboembolism or venous blood clot, it will be 1 over 100,000 young population, and you grow up, it can reach to 1 over 1,000 after 60. So the traveler thrombosis or long haul flight as a risk factor, it can increase the risk 2 to 4-fold compared to population. So it is, we say, weak risk factor. This is for general population. If we move to the second category, the risk factor I have already mentioned, like pregnancy, postpartum, oral contraceptive pills, obesity, very important risk factor. Varicose veins. If you have dilated tortuous vein in the leg, it can increase the risk. This is, we call it intermediate risk group. So the risk is higher, in this patient, and we can happen more frequent than patient low population. Then we have the highest risk, which is if they have past history of previous blood clot, in the legs. If you have cancer, active cancer, receiving chemotherapy, this is again high risk. If the patient putting a plaster cast, immobilization, or underwent surgery just recently within the past 4 weeks, this is very high risk group. So this is the risk. So that's very important. We need to educate people who they have the already predisposing risk factor to how to recognize it and how to prevent it, because this is easily preventable disease.
Indeed, there's many precautions, because I believe in medicine, prevention is big key of the success of the patient.
Definitely.
And how as I'll say, like how higher chance will be able to survive and live a normal life. But also, Dr. Mohammed, does the duration of a flight affect the travel-related blood clot, or is it just something that whether it's an hour, 8 hours, 10 hours, it's all about the same? Does it have any relation with it?
Yes, this is very important, because to assure the community that not any travel is a risk factor for traveler thrombosis. Usually it can occur with air travel or through land, by bus or car. But classically with air travel, and we say long haul flight. Definition of long haul flight or long distance flight is variable. Say more than 4 hour minimum. We say 4 hour, 6 hour, or more than 8 hour. Classical one that in medicine for us more than 6 to 8 hour. This is a risk factor. We say long haul flight, but somebody traveling to Dammam from Riyadh, this is not, long distance traveling to a nearby country. So this is for long haul flight going to Europe or transatlantic, going to the States. Classically, you say more than 8 hour, but anyway, you have to take precautions either way to avoid a blood clot. We are seeing it in our thrombosis clinic. We see traveler thrombosis or travel-related blood clot. Okay, and when we just recently we've seen one patient, and when we talk history, always we take history from patient. He had recent travel to Southeast Asia. It was to Indonesia. It was the trip lasting for 9 or 10 hours. Okay, so this is the classical risk, and not only duration effect. So there are conditions why they think it is more with flight, air travel than the land, because in the traveling in the plane or aircraft, usually prolonged sitting in cramped position. This is one. Immobility. If you are not mobilizing, if you are not moving, usually you will have stasis or sluggish circulation in your limbs that will predispose to blood clot formation. This is two important factors. Number 3, that usually, prolonged sitting, compression at the back of the knee, because this is the deep venous system. This is again can lead to sluggish blood circulation. In addition to the environment of the aircraft, usually would, they have pressurized, okay, this leading to decreased oxygen. We call it hypoxia, hypobaric hypoxia. As you go higher up, okay, like usually 8,000 feet, the usual flight, so long haul flight, so there will be hypoxia, low oxygen, level. It will predispose. In addition, the decreased humidity will lead to dehydration. That's why we encourage, to have adequate fluid intake. So it is interplay between, external factors like related to the environment and related to the individual risk factor. Already I mentioned predisposing risk factor, family history, personal history, medication, and etc. So it is usually interplay between all factors that lead to traveler thrombosis.
Indeed, definitely very good points that you really mentioned. And for our dear viewers, you really gotta keep an eye out and guard on this. And Dr. Mohammed, and for our dear viewers, we'll go ahead and take a quick and very important report. Meet you on after. Stay tuned.
Right now with us here, of course, Mohammed Al Turki, of course, physical therapist. And of course, we are here to ask him some question about what are the role for physical therapists and what are the benefits for us. So can you give us information about physical therapists, please?
Physical therapist is one of the specialty that deal with many cases, especially in the thrombosis team. We are part of the team. Not only a physical therapist, the therapist should have a certified lymphedema therapist therapy in order to issue for the patients the proper stocking or the pressure garment that patient need after he take the proper medication and referred by the physician. The pressure garment or the stocking that we are talking about is not like a pressure garment that we find in the market. It's have a special gradient of pressure, a pressure gradient, and it's more pressure that give to the patient's skin and vessels. That's pressure that give make sure that the edema or that's come a consequences after the blood clot that happen in the extremity, mainly in the patients. So this pressure garment can make sure that edema that will not appear or reduce it as much as possible. The most difficult cases that come to our clinic is the patients with the severe conditions and progressive swelling. And sometimes we can give a ready-made pressure garment, and that's easy to fit for the patients. But sometimes patients come with severe edema, and sometimes pressure garment with ready-made is difficult, and sometimes we need to make a custom-made for patients. And this process takes a long time. The patient can take his own pressure garment. Regarding the ready-made, usually we'll take first the measurement if we are talking about the lower extremity of the patients and we're having deep venous thrombosis or blood clot in the lower extremity. After patient will take his proper medication like anticoagulant by the physician, we will take the measurement from the ankle and calf muscles and also the thigh. We'll take the measurement for the biggest round measurement, and then we'll see the best size for the patient, and then we'll issue for him. And then after we'll give him the education how he can do donning and doffing, means how he can wear it and take it off. And how he can protect his skin from moisturizing his skin, also plus the exercise that he can do and what he can avoid from what kind of exercise he can do and what other exercise he should leave in order to prevent any complications. We are not taking any measurement for the shoes. Actually, the shoes, the stocking that can be worn as any stocking. The patient can wear any shoes that he like on the stocking itself. So we are not preparing any shoes for the patients, only issuing from a stocking or pressure garment for them. For the patients or anyone in the at home, he feel that any swelling that happening to his or any redness or hotness in his extremity, immediately he should consult a physician to make the proper investigation about his condition, and in order to rule out any complication, rule out any serious issues, that patient may need proper intervention and medication to save his life, because there is a lot of consequences of the blood clot. It can happen to the brain or even to the lung, and this is serious condition, should be avoided.
We're back, and we are discussing the travel-related blood clot that often is known as, how our very dynamic doctor was explaining, it is often known as the economy syndrome as well. However, we are in discussion with Dr. Mohammed Al Sheef, and doctor, we were discussing in the report the stockings that we saw in the report. So please talk to us about how does it actually protect a person's legs from developing a blood clot, and should only people with the high risk factors actually wear them, or should it just be, for anyone?
Sure. For the elastic compression stockings or graduated compression stockings, it's different from the usual stockings available, the regular stocking available in the market. Is the name, just to explain, it is graduated compression stocking because it has a compression or pressure gradient over the calf, usually 20 to 30 millimeter mercury. Then in the ankle area, less pressure will be 20, then in the thigh will be 10. So it's graduated, so have the highest level of compression at the ankle, then less extent in the calf, then the thigh. That's why it graduated. The idea to squeeze the blood in the superficial venous system, then it will go to the deep vein system, then it will enhance the blood flow. Remember, when we have travel in long haul flight and we have prolonged sitting, what will happen? The stasis, as I mentioned, it will cause, sluggish circulation and pooling of blood in the calf veins. Remember, when we walk, what will happen? We'll have the calf muscle will exert pressure or compression. We call it venous pump. It's like a pump. So when you exercise, what will happen? It will move the circulation. That's why if you travel for long haul flight and after like 3-4 hours, you find your leg is swollen. Isn't it?
Yeah,
okay.
Yeah.
Or edema. That's why, because what will happen, this is the venous pump is the muscle, the calf muscle. That's why what will happen, the stocking, it will compress the venous system.
Artificially, like a pump.
Like a pump. It's like a pump, okay? So it will happen, it improve the circulation to our extremity, and it's different, you know, that it has to be proper fitted stockings, not any stocking, because for somebody who's obese, might have different, you know, size, like double, triple X large, than somebody who's slim, he will take medium. So it has to be proper fitting, garment or stockings. It's important, and not for everybody. So low risk people, we don't recommend. We'll speak about other, you know, precaution or preventive measure, usually for intermediate risk with predisposing risk factors.
So it's
and
not for
high
everyone.
risk, not for everybody. So for intermediate risk, again to repeat, intermediate risk, if you have pregnancy, postpartum, oral contraceptive pills, varicose veins, obesity, you have hereditary clotting factor, and etc. Okay, and other medical illnesses. And high risk factor, high risk group, again, this is very important, because high risk, yes, it's indicated to use stockings, and it's supported by what we call evidence-based medicine. There are trials supporting the benefit of the use of stockings in the prevention of blood clot, travel-related blood clot. So for high risk and intermediate risk, we recommend to use. And where is it available? If you go to the library, if you go to the pharmacy, not any pharmacy, so you have to ask about the proper size and fitting. For us in our hospital, as you have seen in the report, if a patient, you know, we send the patient to the physical therapist. Physical therapist specializing in lymphedema, they will take special measurement for the calf and ankle and the thigh, then they will provide. There is two variants, below knee stocking and above knee, or thigh length and knee length.
So it's very important to get the actual measurement.
Sure, actual measurement has to be proper fitting, and for traveler, usually garment is below knee. You don't need above knee, okay? There is above knee, there is below knee, and there is pantyhose, okay? So just below knee with pressure gradient 20 to 30 millimeter mercury, it will be adequate, okay?
And Dr. Mohammed, thank you so much for joining us today. Any last words of advice or recommendation you'd like to give our viewers, especially the ones that are very, like how I would say, they travel a large quantity time of the year?
Good. So prevention is better than cure, and usually non-pharmacological or behavioral maneuver. So we need to prevent the traveler thrombosis or travel-related clot. We need to have frequent mobilization, frequent mobility. So we don't sit. So every 1 hour we go around and move. This is number one. Adequate hydration. We have to drink a lot of fluid, because dehydration causes increased blood viscosity. So we have to drink a lot of water. Number three, calf muscle exercise. You are sitting, you can move your ankle up and down. It will improve the muscle pump and improve the circulation. In addition, some kind of seat, like aisle seat is better in terms of risk of traveler thrombosis, because they have more room for the legs. They can leave and they can walk anytime. Okay.
And again, thank you so much, Dr. Mohammed, for joining us today. It was very enlightening at that. Even for me, it's like, now that I'm going to be traveling, even by a car, I'll be thinking of that, trying to get the socks, of course, and making sure that I'm safe, I'm not in the hospital, God forbid. Definitely thank you so much for joining us today. It's very enlightening and very educational at that.
Thank you very much. Okay.
And for our deep viewers, that was Dr. Mohammed Al Sheef, who is a consultant in internal medicine and vascular medicine. And today's discussion is about travelers, thrombosis, or travel-related blood clots. Something that's very, very important. It can and will affect everyone that really travels a lot. At the moment, deep viewers, we'll go ahead and take a quick and very short break and be joined right after this. Stay tuned.